Come back home. A hotel in Matatiele in the Eastern Cape has reportedly been turned into a care facility for COVID-19 patients while still open for regular business. The Royal Hotel is open for essential service permit holders during this lockdown. To discuss the safety of such an operation, I'm now joined by the Eastern Cape Health Superintendent General, Dr. Thobile Mbengashe. Dr. Mbengashe, a very good evening to you. Thank you so much for being on ENC. Let's start firstly with confirmation that the Royal Hotel, I believe is the name, is indeed being used as a COVID-19 care facility, but still welcoming those visitors who have essential service permits. Is that true?
Look, I cannot confirm that, but what I know is that we had students who got sick, who were positive around the Matatiele. What we've been using the B&Bs. We try to confirm this story that this is true. The only hotel we know is the Savoy Hotel in Umtata, but most of our patients were sitting in the B&Bs. Now, let me explain what the procedure is. The COVID, the level 3 and the admission requirements in hotels as we sit right now, everyone is treated as a potential COVID patient, meaning that the protocol that they use, they do not serve food and they don't allow people to go into your hotels, and then your hotel is used only for you. So, but that's really the procedure. And if we have to put someone in a hotel, we want to make sure that that hotel is COVID compliant and it's not being used by other persons at that point in time. Because anyone who gets into those hotels from our side, in terms of isolation, that person is confined to that place and he cannot move around.
But as things stand, you are not aware of the Royal Hotel being used as part of your operations?
No. I mean, with the students that we found in Matatiele, they're in B&Bs. Some of them are now hospitals. And I know that the hotels that were there, they did not want to admit it, our patients, and we're keeping them at the B&B, and we're keeping them at our hotels, our hospitals.
Okay, Dr. Mbengashe, let's speak about the B&Bs and I think you said it's the Savoy Hotel, where you are indeed having some COVID care going on. In those facilities, do you have a situation where you've got both the people who you are treating as COVID-19 patients who are being accommodated there, and still having those facilities welcoming people, now that the regulations allow, who are traveling on essential service permits?
No, we don't. Remember, any sick patient who is actually sick is only kept in hospitals. What we keep in B&Bs, and these B&Bs are now designated by Public Works as COVID quarantine sites, and they have to adhere to that rule that they are now designated. So we're not mixing patients between ordinary, ordinary visitors hotel and our COVID patients. Now, the COVID patients, they're asymptomatic, they are not sick, they are just positive, and they're there for the 14 days. But we keep them in separate COVID-assigned B&B. And where we're using hotels, we actually have to make sure that they are in those COVID-positive hotels, and they are separated, they are not mixing with anyone.
Let me ask you about the cost then. Because the Eastern Cape Health Department, we've been reading this week that you're running out of money, possibly even broke.
Listen,
can you afford to keep this going?
Yeah, I don't know where that story came from, but remember, what happened is that the province has actually got budgets, and every province, I'm not running out of money. I'm the accounting officer of the Eastern Cape Department of Health. I am not running out of money, but what we know that we would need additional money to be actually able to deal with the COVID patients. What National has done, and we now know that there will be there's a provisioning of additional appropriation to the department, and we've been given the provisional figures, but I can't disclose them now until the due process of appropriation is done. We are not running out of money. The province has been appropriated money, and the whole government is making sure that there's sufficient money to run the services and there's money to run the COVID program.
Another question then, Dr. Mbengashe, how much have you spent so far on the B&Bs and the other facilities where you're accommodating the people who you are essentially screening for this 14-day window?
Now, this is actually, this part of the management of the quarantine is a Public Works section. Public Works manage all our quarantine. They pay for it, they manage it, and we just identify a patient for quarantine, and public works use that. But what we know, that public works have actually got very good rates. These patients who stay in these B&Bs and hotels, we are not paying the normal rate. They have been actually highly discounted rates. Now, I can't tell you exactly how much has been spent onto that. So the rate sometimes is as much as half of what is the usual person who pays. But it's not on our tab. It's usually done by the public works.
Let's move on to, all right, thank you, Doctor. Let's move on to another disturbing headline that's come out of the Eastern Cape. We saw pictures in the last 24 hours, in fact, of expectant mothers lying on the floor. I'm looking at one of the pictures now. One woman, heavily pregnant, leaning against a wall. These are apparently from the Dora Nginza Hospital. Has that situation been sorted out?
Look, that was true, that Dora Nginza had a huge problems of managing the maternity. This was caused by two of our what is called maternity and obstetric units that were not taking patients. That problem has been solved in one way. We managed to open one of the maternity, NOU, in Utinake, and we're also getting some additional patients, nurses to come and assist. It's something that really, it was unfortunate, it should not have happened, but we're really arranging and managing it. And really the big persons who really went very well were the doctors into that. And the reason it also arose was that many of the nurses have got sick, and some of those they haven't gone sick and they just took sick leave. And it's something that we're following very closely, that it's inappropriate to take sick leave in order not to do your work. But it did create a problem, and it was almost a crisis that we now have averted.
But it is your word then, Dr. Mbengashe, that if anyone were to go to Dora Nginza tonight, they would not find a situation where the maternity ward is overcrowded with mothers, in some cases even lying on the floor.
No, there will be no one lying on the floor, but what we are proposing, what we are advising our patients is that we do have maternity and obstetric units in the district hospital. So only people who should go to Dora Nginza are patients now that have been referred. So it's very important that we should not overload, because even Dora Nginza has limited capacities if too many people come. But people will be attended if they go to Dora.
I hear you, Dr. Mbengashe, but the question that this raises is, surely someone should take responsibility when you've got to a situation where mothers who we're reading were in advanced stages of pregnancy, are leaning against walls with very little support, some lying on the ground. Again, someone in hospital management should have been able to get ahead of that problem. Is anyone being held responsible, facing an inquiry of any sort, being suspended possibly?
Look, this is a very unique situation. That's not normal management problem. Is that when you suddenly have patients and nurses who are either positive and those who are actually contacts of individuals who have been taken for quarantine, and that really does create a huge problems in terms of the staffing. The second problem is that when the other Vita hospitals, they are not doing their ordinary obstetric services, that creates a huge problem. We are really following this up because we feel that it's unfair for people to take off when they're supposed to be at work and creating this kind of things. And I think anyone who's found to have really not being at work and has no reason to be at work, consequence management will be taken against that. It's something that we're really saying to our staff, it's probably inappropriate to put mothers and their young ones at risk by not actually being able at work. And it's something that we're really working on.
Okay, very quickly, Doctor, you mentioned Utinake Hospital as part of the solution as you try to deal with these numbers. Utinake, Dora Nginza, Livingston, those are the hospitals that we're reading are teeming with patients and really buckling under pressure due to staff shortages and the like. At what point can you say, as the Eastern Cape Health Department, all three of those hospitals will be up to standard with the best possible care, not just for patients, but for staff as well?
Yeah. Look, what we have done is that we realize now, I think again the problem is caused by the acuteness of the infections amongst healthcare workers. We're putting a lot of effort now in occupation and health and making sure that our staff understand. We put up a big advert. We're actually looking for illness who's actually there, who can still come. Obviously, those who are elderly and who have chronic diseases will actually discourage them from finding a work. We have been actually appointing in the past 3 months over 7,000 nurses and other general workers in order to make sure that, and when we understood that we're going to be getting these crisis levels where more people are coming in, and we need to make sure that we've got more staff in our system. It's a problem that we're resolving, and we're really asking people to stay within their referral system, because some of the lower level hospitals, they still have a lot of space, and we're also creating another space. We'll be creating this new 1,400 hospital at BW, and it's starting on the 1st of July. That's going to give us a lot of relief around the PE.
But here's the worry, Dr. Mbengashe. If you're already battling with these very glaring problems across 3 hospitals already, that causes a loss of faith among people in your province about your readiness for the peak. Why should they believe that you will be ready to meet the peak?
No, they should believe we'll be ready. We have opened, and you have seen that the minister opened up 1,400 bed hospital, a field hospital. That hospital is admitting their first patients on the 1st of July. That's going to make a huge difference in terms of the services around those hospitals. The hospital has got ICU, it's got critical care, and it's got isolation and quarantine services. And that's one of the first phase. When that hospital is complete, we'll have about 3,900 beds, and that's going to be done in the next in the next 6 weeks. So we are really understanding that the metro area around PE is one of our hotspots, and we've gone right out to make sure that there's sufficient facilities for patients who come in.
Okay.
We expect that in July and August, and we'll make provision for that.
Dr. Matatiele Mbengashe, Superintendent General of the Eastern Cape Health Department, thank you so much for being on ENCA.